The VALENTINO trial is one of a number of studies looking at what is the best so-called maintenance approach. We know that combination chemotherapy is effective in colorectal cancer, but you can't continue it forever. Patients really get too many side effects. There's cumulative side effects. And so the question is, what type of maintenance approach can we use following an initial period of aggressive combination chemotherapy where the patients would continue to get benefit and we don't lose efficacy? So the question that the VALENTINO study addressed was, can you use maintenance therapy with panitumumab alone, or do you need to use panitumumab plus 5-FU? Because multiple studies have shown the benefit of continuing with 5-FU maintenance. So this was a continue the EGFR inhibitor versus EGFR inhibitor plus 5-FU in the maintenance setting following first-line colorectal cancer therapy. The upshot of the trial was essentially that maintenance with 5-FU is needed. In other words, the more controlled arm, if you will, where the 5-FU was given with panitumumab, outperformed panitumumab alone, indicating that for whatever reason, we don't fully understand the biology of this, but for whatever reason, we need to continue the 5-FU. The practice implications are simply that we don't change what we've been doing now for several years, which is 5-FU should be the basis of any maintenance approach, and whether or not patients receive targeted therapies such as VEGFR targeting therapy like bevacizumab, or an EGFR targeting therapy like panitumumab or cetuximab in addition to 5-FU would be really a question for the individual provider depending on toxicities and other things. But this trial indicates we do seem to need that 5-FU if we're going to try to use an EGFR inhibitor in the maintenance setting.